What has guided us is one principle is like, make it happen. The team worked double the time. There was no weekend. There were white nights. There were people who stayed up 48 hours in a row. But they were all very motivated because they knew that behind every line of code, there were families, there were women, there were children, there were vulnerable groups, there were elderly people. So the motivation was very high and people were very committed to the delivery.
Lebanon has gone through its fair share of crises in recent years. In 2019, it witnessed the start of an economic crisis that was so bad, the World Bank ranked it among the most severe crisis episodes globally since the mid-19th century. The hardships endured by Lebanese only got more intense in the years that followed, and social safety nets became a necessity. Hello and welcome to Inclusive Finance Frontiers, a podcast by CGAP. I'm your host, Lamis Daoud. Let's start off with some helpful context. In 2019, the government of Lebanon defaulted on foreign debt. Dollars dried up, and banks didn't have enough cash to pay depositors waiting in lines outside their branches. And so, they closed their doors. March of 2020 comes and the COVID-19 pandemic hits, exacerbating already existing problems. And then, in August 2020, the Beirut port blast devastated the nation further. These shocks plunged many Lebanese into poverty.
Lebanon's deep financial crisis is affecting every aspect of life there. There is no consistent electricity. Most poor go hungry. Joblessness is at record levels. And with its currency nearly worthless, most Lebanese keep their savings in U.S. dollars. But even those savings are now hard to retrieve from banks.
Lebanon had a donor-financed national poverty targeting program, but it only covered a small portion of the population. So in late 2020, the World Bank presented a plan to extend the coverage of the program. It set up a $246 million social safety net project to provide cash transfers and access to social services to people identified as living below the extreme poverty line. Social safety nets are programs used around the world to help individuals manage shocks and protect families from poverty, including through financial tools such as health and unemployment insurance and through cash transfers. These programs frequently offer a first experience with formal financial services, and they can provide an important on-ramp to financial inclusion. The problem was that the government of Lebanon did not have some of the key building blocks in place for the implementation of such safety nets. For example, there was no national unified information system, known as a social registry, that keeps updated, verified info on the welfare of households. Such social registries are common around the world and act as a way for people to apply for various social programs. Enter DAEM, Lebanon's digital social safety net system, a silver lining in the Lebanon story amidst the doom and gloom. DAEM is Arabic for support. It was built top to bottom by Lebanese, for Lebanese, to help get families the money and support they need to keep going. For many Lebanese families, the DAEM system has been a lifeline, providing not just financial support, but also a sense of hope. Today, the recipients of the National Poverty Program have successfully migrated to the Emergency Social Safety Net Program, or ESSN for short. Through DAEM, the ESSN now reaches over 165,000 Lebanese families, over double the number of families that were included in the National Poverty Program. DAEM is also being used to support families impacted by conflict and is even being used by different governmental institutions. We spoke to a variety of experts to find out how DAEM came to be, the challenges faced in setting it up, and how the country is planning on building off of DAEM's success. Marie-Louise Aboujaoudi is the project director for the ESSN program.
The social protection program in Lebanon aim, first of all, to provide assistance and support to vulnerable population, especially those facing economic hardship, unemployment, disability, or other challenges. The SSN started in an emergency. We had economic crisis and then the COVID. The Lebanese government do not have the capacity to and resources and the expertise to fully implement and manage a program like this, especially that it was needed to be implemented and to start disbursement really very fast. And the program is very complex.
What made the program so complex was the capacity building of the government, meaning the ability to build, resource, and operate a local program successfully on an ongoing basis. Something that's even more difficult to do amidst crisis. Ahmed Fatih Ortakaya is a senior social protection specialist at the World Bank. His work focuses on the Middle East and North Africa, including Lebanon. We spoke to him to learn more about how social protection systems work and what made Lebanon's case so different.
Our intentions from the first day is to establish capacity at the government so that government doesn't depend on anybody. That includes a UN agency, even to the World Bank, except financing, because the intention is to, as long as government has the capacity and to be delivered, it doesn't require any other external resources, right? That's the intention. We thought this is the best way to proceed is to establish a registry that is owned by the government, hosted within the borders of the country, where the system right now, DAEM Social Registry, is hosted at country's national telecom authority's data center.
Local ownership and adaptability were high on the agenda, so they decided to build the system from scratch. During COVID, the Lebanese government hired a Beirut-based nonprofit called Siren Associates, which helped develop a national digital platform to distribute and track vaccinations to their citizens. Siren's approach strengthens organizational capacity and leverages technology to address barriers to social, political, and economic inclusion. Carola Cherabati is the research director. She spoke to us about how Siren was tapped to model a digital social protection system following the success of their COVID vaccination platform.
And the idea is to deploy a system that was fully digitized from A to Z, just like we did for the vaccine. So the registration, the selection, the payment, the cash transfer, the verification, the dashboard, etc., everything was digitized. And we used the same framework, the same ecosystem, the same machines, the same security protection, the same data governance approach we used in the vaccine. The journey was a wild journey because, in this part of the world, the decision maker, they decide to build the system when they want to use it. So it's not like plan ahead and they give you 1 year to think it, design it, roll it, pilot it, etc. No, it's like they want it right away. And this is not an off-the-shelf product. This is a product that needs to be conceived. And in a very difficult environment where you have very little support. You don't have unique ID, you don't have digital ID, you don't have, data governance, procedures or anything, or cybersecurity. So we had to rebuild all this and develop the system in a relatively very fast record time.
And this was no easy task. The program was very difficult to develop. Lebanon does not have a process to leverage the national ID of citizens as a unique identifier. On top of that, names in Arabic can be spelled in multiple ways, and dates of birth are written in different formats, which could cause duplication errors in the registration phase. But nothing stood in the way of Siren's determination to tackle these and many other challenges. The team, made up of people with an average age of 25, worked non-stop to make it happen.
What has guided us is one principle is make it happen. So anytime we had something blocked, something slow, a decision not being made, or a law that doesn't exist, or ID, digital ID that doesn't exist, we had to invent something to make up. It's a sprint where from the beginning you tell yourself, no matter what happened, I'm not gonna stop. So I'll have to jump over any obstacle, invent, be creative, and make it up for anything that's missing so that I make sure I get there. So it's make it happen. So this is a bit the spirit on this project. And it's because it was in circumstances in the country where the administration was very weak. The team worked double the time. There was no weekend. There were white nights. There were people who stayed up 48 hours in a row. But they were all very motivated because they knew that behind every line of code, there were families, there were women, there were children, there were vulnerable groups, there were elderly people. So the motivation was very high and people were very committed to the delivery.
And they delivered quickly. Once the digital infrastructure was built, it was immediately put into action to register impoverished Lebanese and get them the financial help they needed to withstand the economic crisis. That's according to Marie-Louise.
We start the registration in 2 months. We close the registration. After 17 days, we start the household visit. After less than 1 month, we start the payment. The payment was gradually. So we were dispersing to the beneficiary and developing the system.
Thanks to the social protection information system that DAEM provides, families now have access to cash quickly and without any of the social stigmas of waiting in line to get it. This increase in privacy is helpful for people to get the services that they need when they need them. But can the program go one step further and potentially open the door for financial inclusion so that DAM recipients can reap more long-term benefits? We spoke with Soraya Sbeh, a senior financial sector consultant with CGAP. Her work focuses on financial inclusion, payment systems and regulation, and social protection systems.
Government-to-person payments, or what we call G2P payments, can be an important driver of financial inclusion, as they often are the first experience with formal financial services for many recipients, for many low-income people. Financial services can help people manage risk, they can help preserve the gains made in good times, and also they can help with rebuilding their lives after the crisis. All of this, of course, if financial services are designed to meet the needs of low-income people. So concretely, financial services can help you save, can help to safeguard financial assets sometimes, or to send money to family members, or receive small grants or small loans and rebuild the business after a shock. Inclusive finance has a very important role to play in countries that are impacted by crisis or by conflict.
According to the Organization for Economic Cooperation and Development, the OECD, 3/4 of people living in extreme poverty live in countries affected by fragility or crisis. And by 2030, 86% of the world's lowest income people are expected to be living in fragile countries. Many are financially excluded in such environments, which makes reliable safety net programs so vital, as Soraya highlights.
This is why the example of Lebanon is so important. It shows that even in the context of a deep and complex crisis that happens over several years, building government capacity through a local partner like Siren can work. So we can build infrastructure that will set the stage for recipient choice and more broadly for financial inclusion outcomes.
And other inclusion opportunities can also follow by building upon the digital safety net as it exists. Nadine Shadi is a senior financial sector specialist at the World Bank and formerly a CGAP colleague. Her work largely focuses on Lebanon, Jordan, and Iraq, and on cash transfer programs like DAEM.
The idea down the line is to be able to disperse on accounts digitally, but also provide useful products on top of an account, which is where you're actually maximizing the benefits for the recipients. You're empowering them, not only by preserving their privacy, etc., but by opening up the whole range of possibility that cash does not really easily allow for. And I'm thinking of all sort of other products beyond micropayments, we're speaking microinsurance, micropensions, microcredit, where it's relevant, etc. And this is how you actually maximize the financial inclusion benefits for the recipients beyond the program.
So how are Siren and government agencies working to build on the momentum they have? Carol gave us a glimpse into how DAM is being maximized and the intergovernmental connectivity it takes to make all that happen.
There has been a lot of effort put towards leveraging this platform to support education. It's been leveraged by the Ministry of Health, which has used the extremely poor family data to notify the household about the availability of cancer medication and other medical supports on the Ministry of Health. So now you have Ministry of Social Affairs, Ministry of Education, Ministry of Public Health that are connected on this platform. And you have the Central Inspection that has been reactivated as an audit institution. And that's a very interesting thing because it does have a social inspectorate, it has an education inspectorate, it has a health inspectorate. So they have all been activated because finally they have data they can audit what's going on. So we created this virtuous circle in the government in Lebanon that never existed of connecting all these institutions and creating, these checks and balances between them with data being accessible to every side on basis of what they need for them to be doing, and not being accessible for people who want to use it for the wrong reason.
The digital registry that DAM extends can also be used to provide relief from shocks and stresses. Nadine gave us a very real example of how important that is.
We know we're in a region that's going to be hit hard by climate. We're actually seeing it and living it, where you have, flash floods that didn't used to happen. Having sudden flash floods and people finding themselves in the middle of a river or losing part of their homes in those elements, the sea rising, etc. All of those climate shocks are things that we're probably going to see more and more. And again, having a system that's resilient, that is able to actually provide support to impacted people rapidly at scale, is something that we have always missed. If you think of Lebanon, Port of Beirut blast, you actually needed the army to intervene and carry around suitcases of cash to compensate people. And we're speaking about an area 5 kilometers radius around the port, maybe 20-kilometer radius. But if you're speaking of something like a natural disaster or climate event that touches, a larger population, before then, it would have been extremely difficult actually to reach out to people. And now you have that system that allows you to do that. And for me, as a Lebanese citizen as well, it's a fantastic thing to have.
While Lebanon is still struggling to emerge from financial crisis, digital financial services are starting to pick up, and the government and its partners are currently exploring the possibility of disbursing DAEM benefits on accounts offered by banks or non-banks. That's according to Nadine.
That's obviously a very specific challenge in the middle of, historic financial crisis, and in a country where there's essentially no trust in banks anymore. But one, cash has its costs. Be it for financial service provider, like the physical liquidity management that comes around it, for the program itself to actually, get in touch with the providers to arrange for the disbursements in cash, or for the recipients, the actual transportation time and the opportunity cost to actually go wait in line and cash out. I'd like actually also to emphasize the privacy of, receiving support, but not necessarily being stigmatized because of it, and not necessarily being seen as someone who's living out of stipends, is something that's very important, at least in the Lebanese culture. And so we do believe that might play a role in actually people choosing to receive their benefits on accounts. So we're doing this study right now. We're having quite some positive, very preliminary results. It will continue in the coming months.
Fatih tells us that the registry's modular design was devised in a way that each part can work independently but also fit together seamlessly, like building blocks, and that the registry came together in record time.
This project was an emergency project, and government has to launch something from scratch. While we are working with the company that is developing the software, we were making the design. It's a modular design, and government established the intake and registry module. And within 2 months of time, government managed to register half of the population. And starting from registration until the delivery of the payments, it took only 4 months. If Lebanon can do it within 4 months, a large-scale program from scratch, all other countries can do that.
It's an inspiring effort of dedication, foresight, and more importantly, successful execution that involved many actors, including the Government of Lebanon, the Ministry of Social Affairs, the World Bank, the World Food Programme, and Siren Associates. It's also helping rebuild trust between the government and its citizens.
Within this program, we are building trust between, first of all, people, the Lebanese families that are benefiting from this program, and the government. This is one of the successful program in Lebanon, because in 2 years we ended up with 93,600 families benefiting. Right now we have a strong and robust system that we need to really continue developing and building the block on it, and have it as a system where everybody will trust.
And trust is often the byproduct of a program designed to be fit for purpose, which Carol says is the secret to DAEM's success.
When you bring the models from abroad, they don't fit. You cannot just copy-paste models that come from abroad and then push them in local country. You need to adapt to the circumstances, the challenges, the difficulties, the opportunities, the power, the strengths, the weaknesses, and the people and the culture and everything. You need to have locals who are, fighting for their teeth, because it's also they believe in this change. And you also need local partners to be connected to this project. So all these reasons make very important that change comes from within.
That's the end of the podcast today. Thank you for joining me. And thank you to our guests, Marie-Louise, Carol, Nadine, Fatih, and Suraya. From CGAP, I'm your host, Lamis Dawood. For more information on our work in inclusive finance in fragile countries and other topics, visit our website at cgap.org. And if you like this episode, please share it with friends and colleagues so more people can hear about how inclusive finance is transforming lives.